Face-to-face was a concept that had been in my mind for several years prior to getting the pieces in order. And the concept is to have a discussion with someone in a face-to-face fashion that can kind of give them complete facial aesthetic care, both from a surgical and a non-surgical perspective. Quite often, the entire package is needed, even from a preoperative standpoint, and then going through surgery, and then doing the postoperative maintenance treatments that are non-invasive to kind of help maximize the longevity of the procedures. So in getting the right components in place, the right personnel, just the right scenario, is how face-to-face came to fruition. The name face-to-face, it's a personal interaction, a face-to-face interaction, where it's just an individualized treatment plan for someone's circumstances, their goals, their medical history. We take all those things into consideration as we come up to what treatment plan fits you the best. It really varies as far as what line of therapy, as far as if we do invasive surgical procedures versus more non-invasive fillers, injectables, laser. It really kind of comes down to what goals they're trying to achieve. I like to refer to my toolbox. Okay, so what are we trying to achieve? What is in my toolbox to help get us there? And in addition to what's their expectation from a downtime perspective? How busy is their lifestyle? How much time does the patient have to take off from work or their busy social schedule, especially in this area, the community is just so active. And you put all that in perspective. And then you have that face-to-face interaction where you kind of say, well, here's what we can achieve, but here's what it costs you from a time perspective and an economical perspective as well. And we come up with a game plan. But really the bottom line with all this is that you want the patient to feel better about themselves. You want them to feel uplifted spiritually, emotionally, mentally, and they go hand in hand.